Morning, everyone. How's everybody doing? Is there is there a microphone for the feed or is it? It's on. It's just on. So I'm Anthony Portantino and happy to have been invited today to share some of the inside baseball. Joyce wanted me to sort of talk about how things get done. Now, if we all knew how things get done, things might get done. But it is a process. And so thank you for the opportunity to come share and talk a little bit about SB 600 and money that we were on. So here's a test question. How many of you have your state assembly member's cell phone number? How many of you have your state senator's cell phone number? How many of you know your state assembly member's legislative director? You do. Do you have that person's cell phone? So you have some connection. I tell you that story because my journey began because a 26-year-old woman came to my office to tell me about how she lost her fertility because she had breast cancer. And another young woman came to my office and said she found out she had breast cancer and on her American Express card charged to store her eggs. And they told me this story. And I was affected by it. And so that's how, the interaction between constituents sharing their personal stories brought me into this issue. And so that's the biggest piece of the public policy conversation that I want to get across to everybody is it takes sharing your stories directly with policymakers to make them believers, to make them passionate about this issue, about many issues. I changed breast cancer coverage for mammograms because a woman accosted me in the post office. It just happened that there were three 40-year-old women who, remember, you got your first mammogram at 40. That's what everybody was told. And two out of the three on their first mammogram had cancer. One had a double mastectomy. And the women were like, we did what we were told. We went at 40 and it was too late because we had other conditions that should have got us detected earlier. So I changed the way insurance covers breast mammograms based on the conversation in a post office. I did autism care because the autism community came to me and said, wait, when Darrell Steinberg wrote the autism legislation, they only named one treatment. So if you're a family whose kids benefited from an alternative treatment, you had to pay out of pocket. Took me 6 years to get that through. It was vetoed 4 times by 2 different governors. And then finally last year, we were able to get that done. I happened to see the governor's chief medical advisor one day, and I said, thank you for finally getting this done. And he said, Anthony, everybody comes to me with a problem to solve. I helped you because I saw the passion in you for this issue, and I wanted to help you get this done. That's not about me. The point is passion, storytelling, and conviction all matter in how we affect public policy. So you should all get to know your legislators, get to know your opinion makers, get to know their staff. Go to Sacramento, meet them. It's easier to meet legislators in the Capitol than it is in their district, because when they're in the district, they're only there Thursday, Friday, Saturday, Sunday. They spend Sunday with their family. That means they're in the district 3 days. It's easier to see them in the Capitol because they're there Monday, Tuesday, Wednesday, and Thursday. Develop those personal relationships. If you have a story to tell, tell your story, share your perspective. The other interesting part of this conversation is when the women came to me and asked me to do fertility preservation, my first instinct was, well, let's look at the numbers. And so USC did a economic benefit of how insurers would actually save money. Because one of the stories that struck me when I was first brought into this conversation is the number of women who would delay having chemo because they wanted to have their child, and then at the end of the journey were sicker. And it ended up costing more because the treatment that, yeah, you all know better than I know, if you delay treatment, the complications get more serious. And so I brought in all the insurance companies to my office. Here I was saying, you know what, we talked earlier today about how reason is not a good leadership style. I said, I'm going to use reason. I brought in all the insurers. I said, hey, if you cover this, you'll all save money because your patients will be happier, right? They'll store their fertility, they'll get cured, they'll go have a baby. And they all looked at me and smiled and nodded. I said, let me emphasize this again. You'll all save money. We don't need legislation. Do this. None of them did it. But from my perspective, I gave them all the opportunity to do the right thing. And they all turned it down. And then we did the legislation. Now, obviously, as the charts that Dr. Sue put up there, the bill's not perfect. There were segments of the insurance world that were left out. But it's that proverbial, can you get half a loaf or no loaf? And so we were able to get half a loaf. We're able to cover a significant number of Californians. Is there room for improvement? Certainly. Should we continue the battle? Absolutely. And that's why I go back to what I said in the beginning about having those direct conversations with your policymakers. And it's not just about everybody thinks, well, do I need to write campaign contributions? No, it's about going on those legislative visits, making those appointments, looking at them with your story, whether you're a healthcare provider, you have the stories of your patients, or whether you're the patient itself, share that perspective. And so that to me is the most overriding message of how the sausage gets made. It's passion, it's perseverance, it's always believing you're going to get there. I used to say to myself, the best bill idea was when somebody came in and said, you're never going to get this through. And I would say, oh, that's the one I like, because whenever they say you can't get it through, that's the one you want to get through. You know, at the end of the day, personally, I'm a dad. You know, that's the lens that I use as a legislator. And that's always how I've responded to people when they've come to me. The legislature now is just about 50-50 men to women. So it should be a good time for some of these issues. You know, dads get it, moms get it, grandmas get it, everybody gets it. Oh, by the way, one of my favorite stories is when I first introduced the bill, a woman emailed me and said, my grandson's been on ice for 10 years because when my 18-year-old son got testicular cancer, we ended up storing his sperm. And so she made a joke about my grandchildren, or, you know, put them on ice, and she had to pay out of pocket for it. And so I make that point because it's, you know, men and women deal with the cancer diagnosis and the treatment. And so we always have to make sure that we acknowledge that. So that's a little bit of the inside baseball. Obviously, when the bill was in its final stages and we were in the final negotiations, having to take the Medi-Cal piece out, you know, on a principle, I wanted to say, no, we got all or nothing, but we would have got nothing. And so I think it was better to make sure that the bill passed in the form that we could get it through the system, which is what we were able to do. I mean, you all have seen a lot of the charts. I don't know if anybody has any questions for me about the process. I mean, legislators get ideas from folks we talk to. We draft a bill, we introduce a bill. You all know it has to go through both houses of the legislature. It goes to a policy committee first. So a bill like this would go to the health. It might be double referred, go to insurance and health. Then it goes to a fiscal committee. It gets out of the house, whatever house it's introduced, whether it's the assembly or the Senate. And then it has to go through both houses, and then it goes to the governor's office. Just like in Washington, it would go to the president, and California goes to the governor as the chief executive. And there are negotiations that go on throughout the process. That's the other thing. Anybody who has direct access to any of the governor's staff, you can expedite the process exponentially. I always tell people, you know, in this particular climate, the first partner has a lot of influence in the political process. Anybody who has access to the first partner, you know, things can happen quickly if you get the executive branch on board. And so as we know with the Menjivar bill, and Joyce pointed this out to me, I had not read the veto message, but it was a convoluted veto passage. excuse me, the signing message. Yeah, it was oh yeah. I mean, it was a very convoluted message. You could tell that there was conflict in the administration on the Menjivar bill, which, made IVF available to more folks in California, theoretically. And so it's a conversation. Legislation is a conversation that leads to an outcome. It's not just a dry bill on a piece of paper. It's part policy, it's part passion, it's part timing. But at the end of the day, it comes back to what problem are we trying to solve? And that's where the personal stories from the healthcare providers, from the institutions, and from the patients put the well-rounding around the issue. Everybody likes to think, well, I'm right, therefore it's going to pass. Or this is a good idea and everybody's going to see that. That's true. That's the spark. But it's how do you get it through the system? And you get it through the system when you have people who can passionately tell the story. I'll give you, this year I did a bill that one of my interns brought to my attention on fentanyl testing strips. The intern had a classmate who had an unintentional accidental overdose, didn't know what they were ingesting. And so I always have all my interns present a bill idea. And she said, we should let students carry fentanyl testing strips on campus and not have to have any permission from any, just make it easy for students to carry testing strips. Well, believe it or not, I found a picture of the governor with that intern when the intern was a toddler, holding that intern. And so just before the governor we got the indication from his staff that they didn't know where he was going to be on this bill. Sometimes they say, oh, he's with it, he's not. They had no idea. I texted the photo of the governor holding the toddler. And I said, this is my intern. You're holding her. Don't say no to this person. And a month later, he does a podcast where he talked about, a lot of bills come from lobbyists and institutions, but there's this bill that this senator did that came from his intern. And so I texted the dad. I said, he talked about it on his podcast. We're going to get a signature, because you don't talk about that on a podcast if you're going to veto the bill. But it's little things like that that just make a story, make a issue. And when we're talking about fertility, is there a more intimate, personal issue than making a baby? This is something that we just need to continue to just promote and talk about. You're going to hear all of the science. You're going to hear all of the, the specifics. I just wanted to appeal to the process aspect of it. When you talk to a politician, it's an opportunity to affect change. And even if the first conversation isn't positive, you go to someone else. That's the other thing. Within the world of people are competitive. I used, when a nonprofit or somebody would be doing a fundraising effort, I used to say, well, what you need is one politician to write a check, and then you go tell all the other ones that so-and-so, and then they'll all write checks, right? And so getting somebody on board from the passion in your eye, the personal stories makes a difference. Does anybody have any questions about any of this stuff? Yes.
But for example, I work in pharma, and we have a lot of programs, not just in the fertility space, but across several therapeutic areas. And all of these programs we have for patients across the board, and this is not just our company, but several pharma companies I work for, they all have a disclaimer that says all these programs are not available to fertility healthcare program beneficiaries, including but not limited to state Medicaid and state Medicaid managed care recipients, based on the anti-kickback statute. And I know it's different from state to state. So I don't know, can you put some color around what does that really mean?
I'm confused by you just telling me what you just said. So because there's an anti-kickback provision, they can't cover,
Charitable.
Okay.
It's not just in the fertility space, and Joyce, you could speak to something which was something that was, opinion was just written where they couldn't make a decision, yes or no.
so do me a favor, is there like a one page? Can you send me a paragraph on that problem?
Yes.
And what I'll do is I'll send it to the chair of the Judiciary Committee to get his perspective. He was my roommate, so
Okay.
I was his landlord, so he owes me. Right.
Instead of trying to weed through what Illinois provides versus California versus Nebraska, all these companies do this broad brush
Right.
statement and say, no, none of these patients are eligible for these programs that provide discounts or free coverage.
All right, get that, and obviously California being the biggest state, if we can solve it here, would have, yeah, so get me that and I'll circulate it. You know, Susan Rubio, the chair of the Insurance Committee, is a friend of mine. Carolyn Menjivar is the new health, so I can circulate it to a number of senators to try to, yeah, I'm curious as well. Yes, sir. How is it what? Policed? I mean, it's law. It's a good question. I mean, largely, I mean, you want to speak to that?
So we're gonna hear from the attorneys commissioners. We have a speaker this afternoon on this topic.
Yes.
So the final version was different than the way it was introduced and the way the three previous versions were introduced in terms of being more typical mandates and legislation. How did that happen?
We had to disguise it so it wasn't a mandate. Because there's certain buzzwords in Sacramento that nobody likes. Mandate's one of them. So we had to make it a mandate without calling it a mandate. And so we had to use a lot of word things, but we got it done. So that's part of the, you know, that's where at the end of the day, sometimes you walk away, sometimes they water things down to where it's like, no, I'm not gonna do that. Sometimes you send it to the governor's office and they tell you they're gonna veto it, but you want to say, you know what? You know, screw you. You know, we're gonna make the point and, you know, and that's where sort of the art of being a legislator comes in. You know, sometimes it makes sense not to make them look bad. You know, if they give you the indicate, like on autism, even though I'd gotten 4 vetoes, after the 4th veto, we had a conversation where it was like, this is getting ridiculous. We got to try to figure out a path forward. And sometimes luck plays the governor's. It turned out that the governor's chief medic, Dr. Gailey, lived in South Pass, which was one of my cities, and my main autism doctor lived in South Pass. And I said, this is ridiculous. You two live a block away from each other. I'll buy you lunch. And so I got the 2 doctors to go have lunch and they were able to make it work. But that was a 6-year journey. So it's always a judgment call. I'm one of the, so I turned out in December 2nd, and one of my frustrations is my epilepsy bill got vetoed last year. And I'm not there to fight that again. You know, that's another one of those issues that's going to take a number of years. And the first year I did not send the bill to the governor. The governor's office said, you know what? We don't want to see this. So I didn't send it. I played nice. Then the next year was like, we tried for a year to work it out with your people and we couldn't. So I'm sending it. So then obviously they vetoed it. But, you know, I'm hoping somebody picks that up. The point is, as rocky of a road it is, this is a classic example. I'm getting the 1 minute mark. This is the classic example of why perseverance matters, why all of you in this room matter, why from a conversation with a 26-year-old woman in my office, you know, 15, I don't know, 18 years ago, to a law being a law, we always have to believe we're going to get there. You know, that's, I think, my overriding message. This is more now than ever, we have to be optimists. All right. It's easy to be a pessimist. It's easy to say no. it's a lot harder to say, you know what, damn it, I'm going forward. And so thank you all for being here this morning. Thank you for sharing. I know you're going to all day share your stories. I'm going to apologize that I'm not going to stay around. I feel a little guilty. I left my wife and daughter. We live in Burbank. Luckily, we're not part of a fire zone, but I want to get home by lunch to be there. Because they're all home and they're going, where are you going this morning? I'm going to talk about fertility. Anyway, thank you very much for being out, and Joyce and Dr. Sue, thank you for inviting me.